Communication is important for both the patient and the clinician. In the following talk, Dr. Marianne Picone talks with her patient Susan about the importance of maintaining an open and honest dialogue, which includes setting realistic goals, modifying treatment plans, and working together to maintain the best possible quality of life.
Hi, my name is Dr. Marianne Picone. I'm the medical director at the Holy Name Multiple Sclerosis Comprehensive Care Center at Holy Name Medical Center in Teaneck, New Jersey.
And I am Susan Zerndorfer, and I am a patient at the Holy Name MS Center, and Dr. Picone has been my neurologist since I was diagnosed with MS, which goes back to the year 2000. Dr. Picone and I have a bit of an unusual relationship in the fact that we had a relationship long before I was diagnosed. I happened to be, my brother had MS, and he was a patient at the MS Center, and I started doing volunteer work and doing some events. I was on the board of the MS Center, and it was in the early 90s when I started with a weakness on my left leg, and then I started, over the years, tripping and falling a bit. I always had scraped knees, always carried Band-Aids in my bag, but I don't think anybody wanted to deal with it at the time. But in any case, as the years went on, it got a little worse, and eventually I found my way to a neurologist in New York City where I live. We did some MRIs, a brain MRI and an MRI of the spinal cord, and along came Dr. Picone.
I think one of the main concerns, particularly when everyone noticed that you were starting to have some difficulties with your walking, I think particularly with your brother's history and knowing him and his having MS, that certainly increased the suspicion that was what was going on. And then after you had the testing done and the MRI findings and so forth, that did establish a diagnosis. And then I think what I really admired the most about you, knowing you at that time, was your attitude of, okay, this is what it is. It was almost, I think, a bit of a relief at the time, too.
Absolutely.
Just knowing what was going on, right?
That's right.
And
although it was my greatest fear, my worst nightmare, there was definitely a sense of relief that, okay, now I know.
And then what do we do?
Right. And then we I have to say, we moved into action very quickly,
Yeah, and I think that was so important. I think once you knew what was going on, what do we do next? And is there a treatment that I can go on? And you did. You went on disease-modifying therapy right away.
At first, we went on we started with the chemo treatments.
Right.
And which was a pretty aggressive, from what I understand, a pretty aggressive treatment at the time.
Yes.
And I think it was over a 2-year period that I went for these infusions every few months. And I think it was designed to slow down the disease,
Yes.
the progression of the disease, which I think, helped. I always say the bad news was I had MS. The good news is I had the MS Center. Anyone with MS, I feel, should be treated at an MS center where, just know everything that's going on. But yes, we did do the treatment, and then I started on the injectables shortly after, and we moved on from there.
And I think that's a really good point. I think that it was a team working together. You were always, from the very beginning, very open about your goals and your concerns, what you were hoping to achieve from the therapies, and what you wanted to be able to continue to do.
Right.
And besides myself, the nurses at the MS Center, social workers, everyone was working together to try to enable you to have the best outcome.
Right.
And I
right,
think
right.
that is something that is different, as you said, at an MS Center compared to a
Right.
general office.
Right. Just up on everything that's available and that is around. And my goal, being that I live in Manhattan, lived in the city all my life, and I grew up walking the city. So my goal was to do anything I can, anything I could to keep walking. And along with Dr. Picone, anything that came along, we had heard about this electronic stimulation device that stimulates the nerve that picks up the foot so it doesn't drag and, when you have drop foot. So I immediately went to be evaluated for that, and I got one for my right leg and then the left leg. Then I started with a knee problem. I got a brace. My goal in life is to keep walking.
And you also had the courage to get involved in a clinical research study.
That's right.
That also, for a new agent at the time, that could potentially improve your walking ability. So it turned out to be very helpful for you. But that did take a bit of courage at the beginning to
Right.
take the chance to
Right.
participate in the study.
Right.
And I think that's also
Right.
adds to
You know.
the things that I admired about you.
And the fact that when you do have a chronic disease, it's just so important to be able to have somebody that you can discuss anything with. I mean, there are so many new therapies that, come around all the time, and we always discuss it. And whether, and it's a joint decision-making
Yeah.
process, I'm always very fearful of starting new things because I'm the kind of person, I know what I have, I don't know what I'm going to get.
Right.
So, and I also just want to keep doing what I'm doing. So don't want to rock the boat too much. But it's just so important to know what is going on out there and what is available. And for you, as my doctor, to know me and my life, my lifestyle, and my goals, and what is important to me. And I think that's what we have, that kind of communication, because, we've also just been together for so long.
Yeah, I think that's made a big difference, and I think we've talked about what helps make a good physician, what helps make a good patient, how best to work together with one another for the common good, and I think the open communication is key. As you said, we talk about when a new therapy does come out. Will this work for me? What are the benefits? What are the risks? How am I doing? What are your goals? How's your overall lifestyle? What other medical problems may be going on that could interact with a new medication? All these things really are so important. And I think that's why, particularly in MS care, there's no cookie cutter approach to everybody because
Right,
everyone
right,
is so different.
Right. That is true. There are no two people that are alike. And I having primary progressive MS, it's just something that progresses. So if we can, keep that progression as slow as we can, that is, and I kind of feel pretty good considering it's been really over 18 years because I was diagnosed in 2000, but it started so far.
Exactly, right.
That, but just having the partnership that we do, and I think we spoke about that once too, that, the patient-doctor relationship should really be that. kind of like a partnership in one's health and one's lifestyle and one's, a future. So I think it's been a very positive relationship.
Yeah. Well, one of the other features that you've always exhibited is resilience. I think that throughout the years, there have been challenges, particularly with some of the stiffness that you might have had, some of the walking difficulties, and again, foremost was always, what can we do to keep you walking? But your resilience and your proactiveness in terms of exercise, going to PT, seeking out whatever you could do to keep active has really been so helpful.
Yeah, fortunately, it was always my lifestyle. And, I just want to, as I say, my goal in life is just to continue to do what I'm doing. Things change, my walking slows down, I don't walk as far, but I'm walking. And that's my, that's just where I want to be, me and my dog. Just want to keep walking the streets, the streets of New York City. So.
Well, I think that everybody knows you. Everybody knows you probably in the area there,
They
and
do.
has
They do. They
and
do.
I think your enthusiasm has always been fantastic. I mean, I think in terms of, as you said, even knowing you before the diagnosis was made, in your enthusiasm, all the activities that you did at the MS Center, you've continued. You've continued that throughout the years, and I think that also that positive attitude plays a big role.
It does. But I'm very lucky. I've been blessed with a good attitude,
And good support.
and very
Good support, not just from the team that we have at the center, but from your
Very good
family
support.
members, your friends. You have a lot of people cheering for you.
Yep. And, MS, like I say, has been part of my life for so long that, I go on with my life in spite of it. I just, it's just an interesting, I guess I'm just very used to it. And the bottom line is I'm very grateful for what I have because I know that it could be a lot worse. So between the MS Center, it's going to keep going this way. I hope.
Well, that's the goal. We're going to try to do whatever we can to keep you going. And I think with staying on therapy, staying active, keeping a positive attitude, maintaining the collaboration and open lines of communication, goes a long way.
Agreed. And I will keep seeing you we get together every 6 months, and we review where I am, and hopefully I can just stay there. It's been a good. I think we've had a good run. Part of it is also, that yes, my attitude. I've also been able to, accept my limitations.
That's a good point.
I know what I can do. There's a lot that I can no longer do, but I just don't dwell on that. I'm just, for somebody who used to walk all over the city, I now walk a few blocks. But I have some stairs in my building, and it's just very important that I can keep doing, managing those stairs. I always say, as long as I can do the stairs in my building and get in and out of a car, I can get anywhere I need to go. And that is, and that's really my goal in life. But once again, I've been so fortunate to be involved with this, MS Center, and to have the relationship that we have, that I feel that if there's anything that I need to know down the road, about MS or anything that could benefit me, I'm just in the perfect spot.
Well, that's great to hear, and that's what I hope to accomplish. And I think it's an important point that you bring up too about realistic expectations too. And unfortunately, we don't always have all the answers, and there's no one treatment that is 100% effective. And I think that for a patient to know that being realistic of what a therapy can do, what potentially might happen in the future, and as you said, like knowing what your limits are, I think that's really important, because I think some people have just unrealistic expectations of what to expect from their therapy, and if they don't achieve that, think that it's failed them and stop it and do themselves a disservice.
I know, I that always amazes me, and people ask me sometimes, in anything, be it a drug, be it a therapy, if it's working. And I always go, I don't know, but it's not hurting, and I'm still, doing what I'm doing. And that's my barometer. I'm just always amazed. I bumped into somebody the other day, and they were on this treatment and had very bad MS, and he told me that he didn't think it was doing anything, and he stopped it. And I'm thinking to myself, how can you just do that? I mean, why would you do that? Especially if you're not having any effects. So no. I'll do anything and try anything that's not going to hurt me. I actually remember when we were talking about the clinical trial and starting the clinical trial, and we talked about it, and I remember I had 3 questions. I had 3 concerns about starting this, and the first was any side effects, and the second was whether I could continue with my therapy, with my medication, and the third was if I could keep drinking wine. That was it, because it had to do with lifestyle.
Exactly.
And it had to do with the quality of life. And that's
That's a
another
very
thing.
good point.
I'm very fortunate that I really haven't had to change. I actually love my life in spite of my MS. And, I live in the city. I have in a great neighborhood. I know everyone. I'm always out and about. I have a little dog that everyone loves. And,
Well, I think
it.
you've
That's
said
it.
it all right
That's
there.
it.
I
That's it.
think that's so important. You've said it all in terms of, again, you have MS, it doesn't have you, and we want you to be able to live your life and to the best of your ability, and that's what this partnership is. What can I do to help keep you doing things to the best of your ability?
And to continue living my life the way I want to.
Exactly.
And I think we're doing okay.